Hello, my name is Michelle Matthews, and I'm the owner of Matthews HR Consulting Services and an authorized OSHA outreach trainer. I have over 18 years experience in human resources management, safety program development, and workforce risk mitigation. I know you and your team are working hard to create a safe return to school, and I know the steps outlined here are easy to say but difficult to implement. They will require extraordinary effort and flexibility. But working thoughtfully and together, we can do what we can to allow students to return to school as safely as possible. The CDC has created overall guidance as well as guidance tailored to the transmission level in your area to help child care programs, schools, and their partners understand how to help prevent COVID-19 and react quickly when a case is identified. We're going to cover the CDC's general guidance, but you will need to check with your state and local governments for additional guidance. Big picture, the CDC says the best way to prevent the spread of COVID-19 is through social distancing and disinfection. While we've all heard about wearing face coverings, washing our hands, and keeping 6 feet apart, today we're going to see how we do those and much more in a busy school environment. And while we cannot discuss every possible scenario, we will cover some of the most common. Let's start with masks. The CDC and OSHA are advising all wear simple cloth face coverings to slow the spread of the virus. They are meant to protect other people in case the wearer is unknowingly infected, since many people carry COVID-19 but do not have symptoms. Face coverings should be worn if feasible and are most essential when physical distancing is difficult. For staff and older children who can safely use hand sanitizer, ensure that adequate supplies are available to support healthy hygiene, including soap, hand sanitizer with at least 60% alcohol, paper towels, tissues, and if feasible, no-touch trash cans. It is important to increase the number of hand washing and hand sanitizing stations throughout the school, including all entryways, all hallways, all water fountains, and areas where food and drinks are consumed, and any other areas where students and teachers have a high number of touch points. Key times to clean hands include before eating, after going to the bathroom, after blowing your nose, coughing, or sneezing, before and after work, before and after breaks, and after touching frequently touched surfaces such as handles and handrails, before putting on a mask, and after touching or removing your mask. And always avoid touching your eyes, nose, or mouth. Using warm water and soap for at least 20 seconds is key. Ensure you use a generous amount of soap and water and get all areas of your hands, front and back, in between fingers, and underneath nails. Cold water is not as effective as warm water, but it's better than no water at all. To dry, use clean paper towels and avoid using dryers, which do not dry hands as thoroughly as paper towels. Use the paper towel to turn off the faucet and use the paper towel to unlock and open the door when finished using the restroom. Note that alcohol-based hand rubs do not work effectively if hands are visibly soiled. If hands are visibly soiled, either plain or antimicrobial soap and water should be used first. When performing hand hygiene with an alcohol-based hand rub, apply product to the palm of one hand and rub hands together, covering all surfaces of hands and fingers, until hands are dry. If hands feel dry after rubbing together for 10 to 15 seconds, it is likely you did not apply a sufficient amount of the product. This may require 2 or 3 rounds. If so, consider adjusting the amount of sanitizer that is released with each application. Alcohol-based hand rubs must contain other ingredients such as chlorhexidine to achieve long-lasting effectiveness. Maximizing airflow is critical to reducing virus concentrations. Make sure ventilation systems operate properly. Guidance suggests to keep the air running constantly instead of using the auto fan option, and increase circulation of outdoor air as much as possible, such as by opening windows and doors. Do not open windows and doors if they pose a safety or health risk to children. For example, allowing pollens in or exacerbating asthma symptoms. Current evidence suggests that SARS-CoV-2 may remain viable for hours to days, including 3 hours in the air, 24 hours on cardboard, 2 to 3 days on plastic, and 4 days on wood. Unfortunately, we do not know how long it survives on fabric, shoes, or hair at this current time. Wear disposable gloves when cleaning and disinfecting surfaces. Gloves should be discarded after each cleaning. If reusable gloves are used, those gloves should be dedicated for cleaning and disinfection of surfaces for COVID-19 and should not be used for other purposes. Here's how to put on and remove gloves safely. Wash your hands immediately before putting on and after removal of gloves. Gloves might have small holes or tears that are not noticeable and can increase the risk of contamination and exposure to microorganisms. For proper removal of gloves, grasp the outside of one glove at the wrist. Do not touch your bare skin. Peel the glove away from your body, pulling it inside out. Hold the glove you just removed in the gloved hand. Peel off the second glove by putting your fingers inside the glove at the top of your wrist. Turn the second glove inside out while pulling it away from your body, leaving the first glove inside the second. Dispose of the gloves safely. Do not reuse the gloves. Again, clean your hands with soap and water immediately after removing gloves. Under OSHA regulations, protective eye devices that are minimally ANSI Z87.1 certified safety glasses need to be provided and worn when cleaning and disinfecting surfaces. After worn, they should be cleaned and disinfected and then stored in a cool, dry place where they can be accessed and reused again. Fully open the arms of the glasses and slide on either side of your head over your ears, without touching the front of the glasses. For taking off, remove safety glasses from the side of your head by lifting the arms without touching the front of the glasses. The outside of the safety glasses will be contaminated. If your hands get contaminated during removal, immediately wash your hands or use an alcohol-based hand sanitizer. Always start with a clean surface, otherwise disinfection could be compromised. The CDC recommends the following methods for liquid disinfectant, also known as sprays and aerosols, and disposable disinfectant, also known as wipes. Use products that meet EPA's criteria for use against SARS-CoV-2. Follow training on manufacturer's directions for use. For liquid disinfectant, use the spray, wipe, spray method. Spray the surface with the disinfectant and wipe it using a disposable towel to clean the surface, followed by another spray to disinfect the surface. For disposable disinfectant, instead of the familiar circular pattern, use the wipe, discard, wipe method. Use one wipe to clean the surface, discard the wipe, and use a second wipe to disinfect the surface. Wipe in a straight line, then fold and wipe the rest. Several weeks may have passed since your facility was last in consistent use, so take steps to ensure that all water systems are safe to use after a prolonged facility shutdown to minimize the risk of Legionnaire's disease and other diseases associated with water. Work uniforms worn during cleaning and disinfecting should be laundered afterwards. If possible, launder items using the warmest appropriate water setting for the items and dry items completely. Wear the personal protective equipment, or PPE, required for using the cleaning and disinfection products, according to the product manufacturer's instructions. After removing PPE, you should wash your hands with soap and water for at least 20 seconds. For disinfecting electronics, follow the manufacturer's instructions. If no manufacturer guidance is available, it is usually okay to disinfect touchscreens with wipes or spray containing at least 70% alcohol, but again, you should confirm independently. Be sure to dry surfaces thoroughly to avoid pooling of liquids and use the spray, wipe, spray method or the wipe, discard, wipe method we demonstrated earlier. Phone touchscreens can usually be cleaned using disinfectant wipes, but check with the maker of your phone first. Use a speakerphone when possible or headset touch-free devices to reduce the need to hold the device to your face. If used often, your device will require frequent disinfecting, but most need only be wiped down once or twice a day. For example, at your lunch break and the end of the day. And most aftermarket covers are wipeable. Ideally, it is best to not share devices. However, if the school resources require the use of shared devices, for example, iPads, laptops, copiers, laminating machines, etc., ensure each person is disinfecting before and after each use. For light switches, thermostats, handles, and handrails, and the like, use the spray, wipe, spray method or the wipe, discard, wipe method. Longer-term motion-activated lights and foot handles or even motion-activated doors help keep employees and students healthy, even after we get through COVID-19. For keys and key cards, use the spray, wipe, spray or the wipe, discard, wipe method, including the holders, fobs, rings, etc. When disinfecting desks, sinks, counters, bathrooms, toilets, floors, and any other surface, diluted, unexpired household bleach solutions can be used. For diluted bleach, be sure to use at least 1,000 ppm of sodium hypochlorite. Please see the resources area of the training for a dilution recipe. And be sure to follow instructions for application and ensure a contact time of 1 to 15 minutes depending on the manufacturer's recommendation. As COVID-19 can be spread through fecal matter, consider adding a cleaning aid so the bowl is disinfected with each flush. Consider installing high-efficiency air filters that remove pollutants and particulate matter. For an extra layer of protection, consider HEPA filters. You should consider replacing your filters immediately and at the same time look for a possibility to upgrade your filter type. Additionally, it is recommended to use a disinfectant wipe on all vents and returns as part of your frequent cleaning throughout the day. Each school will need to define what their frequent is, but in high traffic areas, I personally recommend at least 2 to 3 times during the school day and once per school day in not frequent areas. Regular mop and bucket are not recommended for disinfecting. Instead, use disposable floor mop pads or washable microfiber mop heads. Again, use EPA-registered hospital use disinfectant that is effective against COVID-19. Disinfection should be done at the beginning of the school day, at the end of the school day, and ideally several times throughout the work and school day. I know it sounds like a lot, but being proactive will help keep your staff and students safer. Railings, handles, and exercise equipment should be cleaned routinely. Outdoor areas like playgrounds in schools and parks generally require normal routine cleaning, but do not require disinfection. Do not spray disinfectant on outdoor playgrounds. It is not an efficient use of supplies and is not proven to reduce risk of COVID-19 to the public. Cleaning and disinfection of wooden surfaces, play structures, benches, tables, or ground covers like mulch and sand is not recommended. Sidewalks and roads should not be disinfected. If anyone tests positive, work with school administrators, nurses, and other healthcare providers to identify an isolation room or area to separate anyone who exhibits COVID-like symptoms. Close off areas used by a sick person and do not use before cleaning and disinfection. Wait 24 hours before you clean and disinfect. If it is not possible to wait 24 hours, wait as long as possible and ensure safe and correct application of disinfectants and keep disinfectant products away from children. Thank you for joining me today. I know that is a lot of information, but by working thoughtfully, we can help keep everyone as healthy as possible during this difficult time. While these are general nationwide guidances as of the recording of this video in June 2020, please follow the most recent requirements from the federal, state, and local government. If you have any questions on items covered in this training or need additional assistance, please feel free to reach out to me at info@matthewshrconsulting.com. Thank you and stay healthy.